Hello everyone, this is Luis Montes, Doctor of Physical Therapy here at Kiva InMotion. Today we'll talk about something that's very common in athletes, especially younger athletes at the shoulder is impingement syndrome of the shoulder. And we're going to talk about ways to know if you have impingement syndrome and also what causes impingement syndrome. And the answer to that might surprise you. First of all, how do you know if you have impingement syndrome? Pretty easy to know. If you're having pain in the front part or the side part of your shoulder, especially when you're elevating your shoulder, that could be a sign of impingement syndrome. A quick way to test that is called the painful arc, and it's called the painful arc because as you bring your shoulder up, you might be okay, but you might get there might be a point in that motion that there's a sharp shooting pain. And then as you keep going up, then the pain subsides a little bit. You might have no pain here. And then as you bring it down, you might catch there a little bit and feel pain. And then as you go down, that pain is no longer there. Same thing if you go to the side, you might feel a painful arc there. Another quick way to know that you have impingement syndrome is just going behind the back. And if that motion is limited or is causing pain here at the front or side of your shoulder, there's a chance there that you have impingement syndrome. So why does this happen? It's important to understand the anatomy of this. Not that I'm going to take you through an entire anatomy class here at the shoulder, but just really quickly so you can get an idea. This is a model of the shoulder. This is the front part of the shoulder. This is your clavicle, right? And here's your scapula or your shoulder blade. This is the front, right? So here's my clavicle, right? And if you look at the shoulder from here, here's your humerus, right? And your humerus, the head of the humerus attaches here to your shoulder blade or your scapula. This is called your glenohumeral joint or GH joint. Here is your rotator cuff muscles are really important in this whole impingement syndrome because that's part of what gets impinged. Here's your supraspinatus. So I want to take the shoulder like this now. Supraspinatus. The supraspinatus is going to attach into the head of the humerus here through a tendon. Tendon attaches muscles to bone, right? And that's a muscle that will typically get impinged here, and we'll look at that a little bit closer. Then you have here your infraspinatus here on the back of your shoulder, the teres minor as well. All these are muscles of the rotator cuff that are attaching into into the head of the humerus here. And then you have your subscapularis here that's more of an internal rotator. And on top of this sits the deltoid, which is a much bigger muscle, and your pectoralis, which is your chest muscle, right? So all of these are really deep muscles of the shoulder. Primarily are going to rotate your shoulder, stabilize your shoulder, also help with elevation of your shoulder as well. So if we take out all the muscles, right, and we are left with something that looks like this, right? And this is a model with no muscles, right? So again, this is the front part of your shoulder, right? So if I go like this, right, this will be the front part of my shoulder, my clavicle, my shoulder blade, and here is the humerus, right? This is my arm, right? And this is the impingement. So here we're going to have, remember the supraspinatus muscle that I told you about? It sits right here. And then there's a tendon that's going to attach to the head of the humerus here. Supraspinatus tendon will attach here, and so imagine that's my tendon right there attaching to the bone, right? And every time I lift up my arm like this, the head of the humerus is moving upwards towards this part of the clavicle or this part of the scapula, which is called your acromion right there, and it's going to pinch that tendon of the supraspinatus muscle. And that's the impingement, right? There's another muscle here too, which is the bicep, right? So I didn't show you that here, but the bicep muscle right there here's the bicep muscle, and its tendon right there also attaches here, and it goes into this space. This is called your subacromial space because this is the acromion, and it also attaches here, and you can see how that also can get pinched. So your biceps tendon can get pinched, and your supraspinatus tendon can get pinched, right? And those are typically the two main structures that will get pinched with impingement syndrome. There's also a bursa that sits here, and that's more of like it's providing some lubrication to the joint, but don't worry about that. But if any of those structures are getting pinched, you're going to get a tendonitis, right? So you'll get a tendonitis of the supraspinatus tendon, or a tendonitis of your biceps tendon, right? Or you can get bursitis as well. Eventually, with a lot of impingement over time, especially if you're doing things like, serving tennis balls all the time, eventually that could lead into also a rotator cuff tear, right? Which is a tear of the supraspinatus tendon usually. So that's structurally what's getting pinched, but why does that happen, right? A main culprit of it, and one of the things that we train with therapy, is the overall movement of your shoulder blade or the scapula. In order for you to get elevation of the shoulder, not just your arm moves up, but also your scapula is going to move up, right? In fact, also your clavicle is going to elevate, right, to get some full range of motion there. What happens if your scapula or your shoulder blade does not move, right, at this joint, and all of the movement comes from your arm? You can see how the head of the humerus here is just going to pinch those structures, right? And in order to get some space in here, I need to move the arm, but also move my shoulder blade together. In fact, it moves in a 2-to-1 ratio. For every 2 degrees of arm elevation or humeral elevation, we see a 1 degree of motion in your shoulder blade. And that will actually keep this space here healthy enough, the subacromial space, so that those structures, that the supraspinatus tendon, the biceps tendon, and the bursa, have enough room and space there to move, right? A lot of times what happens is that either the shoulder blade is not moving enough on that 2-to-1 ratio, right? And if certain muscles or musculature is tight, your shoulder blade will not move, causing impingement. Or sometimes it might just be moving too much, right? At the beginning of the movement, for example, you should have more movement coming from your arm, and if this is moving together, it might also cause some impingement. So we, in therapy, train the biomechanics of this to ensure that your shoulder blade and your arm, your humerus here, and even the clavicle are all moving in a rhythm that is healthy, right? So that you don't get impingement. And if you're getting impingement, right, we can treat the symptoms of the impingement, like the tendonitis of it, right? We can treat the pain and all of that. But if we don't get to the root of the problem, which is the biomechanics of how the shoulder blade moves in relation, to your humerus, the symptoms are probably going to happen again, right? And if you want to find out some quick routines on how to deal with this and how to retrain your shoulder blade and your shoulder in general to avoid this or to treat it early, you can look at some videos. I did post some videos on this last week, in fact, and should be on our Instagram or our YouTube channel. So I hope that this was helpful in helping you understand impingement syndrome and helping you also know if you actually, this is something that you're likely to have or not. Okay, until next video. Thank you.